you everyone for joining us on this webinar today. Um, this is being sponsored by the Leadership Exchange for Adolescent Health Promotion, and today we are talking about state laws that outline the responsibilities for school nurses. We can go to the next slide. This webinar will be kind of split into three parts, the first part of which is a research presentation from two of my colleagues at Child Trends, Heather Steed and Devan O'Toole. Heather is a senior research analyst whose research and policy analysis is focused on school health, mental health, and social emotional well-being. And Devan is a senior policy assistant, and most of his work is centered around federal and state K-12 policy, especially in school health. And alongside Heather, he helped conduct the policy scan and dissemination of state policies related to school nursing that you're about to hear in a few minutes. So that's going to be the first part of our webinar. A little later, we'll have a moderated Q&A between Heather and Janis Hogan, who I'll introduce a little bit later, and then we'll have an open Q&A for all of our panelists at the end. So next slide. For introductions, please go ahead and put in your name, state, and maybe your role in the chat. I know we have, since this is an open webinar, we have a few different people representing different groups today. So if you feel comfortable, please join the chat and introduce yourself. And next slide. And just as a disclaimer, this presentation was supported by cooperative agreement from the CDC. The opinions, findings, and conclusions don't necessarily represent the views or official position of the U.S. Department of Health and Human Services or the Centers of Disease Control and Prevention. And with that, I'm going to kick it off to Heather and Devan.
Thank you so much, Kayla, for that introduction. Next slide, please. All righty, so Kayla gave us a nice overview of our agenda. Devan and I are going to share with you some of our findings on state statutes and regulations that address the roles and responsibilities of school nurses. Not covered in that brief, but of potential interest to our LEAP state partners. Devan's going to highlight for us some additional policies that touch on school nurses' roles in sexual health services and coordination with hospitals. We're going to have a fantastic conversation with Janis Hogan a little bit later. She's going to share her perspective on as a school nurse and school nurses' experiences on the ground. And then we would love to hear from you. Any questions that you have or things, experiences, challenges or successes that you might wish to share with each other in the chat. They are all welcome and encouraged. Next slide, please. All right, so I know policy analysis can be dry sometimes, so I like to start out with a little story. This is something that we heard, actually my last in-person interview before the pandemic shut us down was a conversation with a school nurse in DC. We were talking about absenteeism and the causes of absenteeism and what kind of health issues might be driving truancy rates in the District of Columbia. And she was talking about the importance of including school nurses at the table in kind of managing students' well-being, you know, not just for the things that come to mind immediately, like health and vision tests or, you know, just distributing medications, things like that, but really kind of strategizing around the whole child and well-being of students. She shared with us with health issues, the earlier you deal with it, you can navigate things, you can link students with resources, but there's often a barrier between school personnel and health personnel on campus. Often the only time that school personnel comes to the school nurse is if they need a vision or hearing test result, or if a student case has gone too far and they can't handle it. but we should be in the loop. We should be at the table. So often we're kept out of the loop. In her case, she shared, the school nurse's office is usually remote. It could be in the basement. Mine is all the way at the end of the hallway. So everything is far away from my office. There's this disconnect, even with the location they choose. So from her experience, she was really, really sharing this sense that school nurses so often work in isolation. So kind of thinking about that context as we talk about some of the policies and as we talk with Janis later about some of the experiences of school nursing and what a unique profession it is. Next slide. Alrighty, so last fall, Child Trends, in partnership with EMT Associates, analyzed the landscape of state statutes and regulations enacted as of October 2021 related to the role of school nurse roles and responsibilities. We wanted to understand how these policies defined the role of school nurses, how they govern the availability of school nurses, what certifications and qualifications are required, what are school nurses authorized to do, and what are they required to do, and then how are school nurses engaged in public health efforts, and how did these responsibilities change with respect to the COVID-19 pandemic. So our partners, our colleagues at EMT Associates, they helped us conduct this policy search within legal databases, LexisNexis and Westlaw. We were searching for policies that included the words school nurse or school nursing. And these were all education policies enacted as of October 2021. So just to share that context, this was, prime time COVID-19 policies are definitely in flux at that time. And just to note that as we kind of talk about some of the policies today, they might have changed, been modified or rescinded since the time of collection in October 2021. Once we had all these policies, we kind of grouped them by topic and kind of discussed about how prescriptive these policies are. And that kind of means, are they requiring school nurses to take on certain responsibilities? Are they encouraging school nurses to take on responsibilities? And what supports are kind of included in that. We wanted to look at this landscape analysis to really get a sense of the availability of nurses in school buildings, the daily responsibilities they perform in service to their students, and expectations for how they contribute to public health. Our analysis was necessarily limited. We, examined what state policies are in place, but we were not able to evaluate their effect in practice. This analysis was also looking at codified policies, and we know that many states have a wealth of non-codified policies. So that could be school nursing manuals, guidance on how to approach the work of school nursing. So this is simply looking at codified regulations and statutes. And then we really wanted to kind of assess what are the baseline expectations of school nurses. We know how many responsibilities are being asked to be undertaken, and so often those responsibilities are informal and not necessarily represented in policy. So let's go ahead and move on to the next slide, and we'll take a look at what some of these policies showed us. So looking at education policies, we found that 35 states and the District of Columbia have policies that require the employment of school nurses, while another 7 states authorize or encourage or address making school nurses available to students. Even among the states that require making school nurses available, those requirements really ranged in how they approached it. Some states, for example, Delaware and Vermont, require a full-time nurse in each school, while others required part-time nurses providing services to several schools, or required nurses employed at the LEA level. And some states also set recommended or required nurse to student ratios, though it must be said that those ratios can go unheeded by districts, and that can come down to a number of things, but including the lack of availability of school nurses. And some of those ratios that states require, those ranged quite a bit as well. We saw, for example, Alabama and Vermont required a school nurse to student ratio of 1 to 500. While on the other hand, Tennessee required one school nurse for every 3,000 students. So that's quite a range. Go ahead to the next slide. All right, we summed up the types of responsibilities that we saw most frequently in these policies. And we found the ones that you see on screen. The school nurse's role in managing chronic conditions can include student allergies, diabetes, and seizures. Those responsibilities can include storing and administering medication, developing and implementing student health plans that are related to those conditions, training other school personnel on chronic disease care, for example, recognizing symptoms of crisis or emergency administration of medication. Some states require a registered nurse to perform these services for students with chronic conditions, while other states authorize but don't require school nurses to fill those roles. And that means that staff without proper medical training might perform those duties, even when the state encourages a registered nurse to be taking those roles. This can put students at risk when non-nurses perform duties that should be performed by qualified individuals. We found that 25 states have policies that describe school nurses' role in administering medication beyond what is specifically required for managing chronic conditions. These responsibilities include administering and storing students' prescription medication, managing students' health records and parental consents, and training other school personnel to administer prescription medication as permitted by their parents or guardians, and then assessing students' ability to self-administer medication. And again, similar to the chronic conditions, some states require school nurses to perform these duties, while others allow unlicensed assistive personnel, such as school administrators, teachers, or other school staff to perform those duties. We found that 21 states have policies that describe school nurses' role in developing and managing student health plans for chronic conditions, as well as other individualized healthcare needs. Those responsibilities could include training other school personnel and volunteer health aides on proper procedures of care, collaborating with students, parents, or guardians and primary care physicians, developing protocols for emergency response, and storing emergency stock of medication. Again, we saw a number of states that require a registered nurse to be involved in creating individualized student health and emergency action plans. And it's really important to note that these individualized healthcare services should be done by a registered nurse. They are specifically unique because they need to be adapted to the school setting or for school specific needs. So when there isn't a school nurse present, it's really, really detrimental to the student who needs that care or those supports. When it comes to student health screenings, we found that 25 states have policies that describe school nurses' roles in these screenings. These can be vision and hearing screenings, dental, BMI, scoliosis, lead exposure, and general physical health screenings. And the responsibilities here can range from scheduling to facilitating and documenting results and referring students to follow-up care. And then we found that 12 states have policies that describe school nurses' roles in facilitating or keeping records of student administration immunizations. We found 10 states detailing requirements for school nurses to administer immunizations, facilitate immunization programs or clinics on campus, or simply to keep and access records of student immunizations. And then finally, we found 18 states and DC have policies that describe school nurses' role in mitigating the spread of contagious diseases. Now, prior to COVID-19, I think the biggest focus here was probably the cold and flu season. So this would often look like facilitating and planning for flu clinics and on-site vaccinations. And again, we found that this shifted quite a bit during COVID. So now thinking about all of these responsibilities that school nurses are managing every single day, that's quite a lot. These are responsibilities that are formalized in many states' policies, but we also know that school nurses take on informal roles and responsibilities as well. And these shifted significantly during the onset of the pandemic. So I'm going to hand it over to my colleague Devin to talk a little bit about what changed during COVID, and then highlight a few interesting policies that might be relevant to our LEAP state partners.
Fantastic. Thanks so much, Heather. That was great. That was a really good overview of what we've been working on. Cassidy, could you send us to the next slide, please? Thank you. So it's no mystery that school nurses' roles increased significantly during the pandemic. Alongside their existing duties, there were many additional roles in public health, education, and overall coordination of school COVID-19 policies. Based on what we read and school nurses who we talked to doing work on the ground, school nurses stepped in to conduct contact tracing, educating staff, students, and families on COVID-19 precautions, which includes school and district requirements on proper mask wearing and general hygiene, social distancing, and other school-based health protocols and safety plans. The pandemic has increased the need for school nurses alongside the demands on them. And, in policy only sometimes addresses who supports efforts related to, addressing some of the increased stressors of the pandemic, such as chronic absenteeism and the impact on other health conditions and academic outcomes. This added to school nurses' direct care responsibilities as students returned to school, as they demonstrated worsened mental and physical health. This has been translated in policy on the next slide. It's been translated in policy somewhat infrequently. So despite the increase of stressors on school nurses and the increased roles they had to fulfill because of COVID-19, we found as of 2021, which is where the timeline for a policy scan here, many of these roles were not codified in policy. But as we know, lots of these roles were informally required of nurses. These are more informal demands, and we know that sometimes the policy world doesn't exactly match up with what's actually happening. So only based on our policy scan as of 2021, only 3 states explicitly discussed the roles of school nurses with COVID-19, and those states are New Mexico, New York, and Maine. However, 4 other states updated their regulations regarding the role of school nurses in infectious diseases as of March 2020. But these updated state regulations did not say anything specifically about COVID-19. But they were within the timeline to be responsive to COVID-19. When we collected these I think it's important to note that when we collected these policies, even though only 3 states have explicitly stated the role of COVID-19, there may have been other policies that impacted school nurses' roles in other state regulations, but it doesn't say that directly. Just based on how the search went, we were looking for state policies and regulations that explicitly said the words school nurses, and it stated discuss their roles specifically, but other related state regulations related to school and community health may have impacted those roles as well. And could you go to the next slide, please? And so there's also our scan covered, since we were covering the school nurses' roles related to infectious diseases, we also were able to get a grasp of some of the roles in sexual health services. Now, on this map here, not all of these policies are directly related to sexual health services. This records all policies related to infectious diseases in general, but I was hoping to highlight some of them that fit into sexual health services that are in the broader category of infectious diseases. So some of the roles that we recorded were school nurses facilitating STI and STD testing, and most of the time through this, it was through referrals to physicians who conducted this testing, such as in Louisiana, where school nurses are authorized to refer students to hospitals for medical screenings. And another role they fill in sexual health services is reporting STIs and STDs to local health departments. Mississippi has an example of this, where it outlines the responsibilities of school nurses. Oh, I'm sorry, Nebraska has a role in this, where school nurses are required to report STIs and STDs to their division of public health, and a few other states have that requirement as well. Mississippi has state regulations related to the responsibilities of school nurses to educate students about STIs, STDs, and HIV/AIDS. So many state regulations outline some of the roles that school nurses may have in testing, education, and coordination with health departments. But like I said before, many of these regulations probably don't cover everything that's going on. There's a mismatch between some of the informal roles that school nurses are playing with the ones that are required by policy. Could we go to the next slide, please? Thank you. And so here, we also were able to record some state policies on the role of school nurses and collaboration with the hospitals. A few states have regulations and required authorized roles that school nurses have in collaborating with hospitals. Some states in California have, California is one of them, have authorized school nurses to collaborate with hospitals for professional development opportunities. They're able to go to local hospitals to get CPR training. A few other states have state regulations that authorize and require the school nurses to coordinate with hospitals for student and youth health records. A few of these include some of the ones I mentioned in the previous slide. In In Iowa, the school nurses are required to coordinate with hospitals to report the onset of all infectious diseases, including STIs and STDs, to the State Department of Health. Maine has a similar policy. South Carolina specifically outlines, as a state regulation that specifically outlines school nurses to report students with STDs to the State Department of Health. So they kind of have a role in record transfer and collaboration with physicians. Some other state regulations include the role of school boards building partnerships between school nurses and school physicians with local hospitals. In Georgia, school boards are authorized to build partnerships with local hospitals to increase that collaboration. There's also a role in pay equity that some state regulations have. In Louisiana, there's a state regulation that requires school nurses to be paid comparable wages to nurses with similar qualifications in local hospitals. And also there's a facet of this that is involved with school nurse availability. Schools can contract school nurses from local hospitals in Texas to support their local health programs. And then there's also regulations that are involved in referrals, where school nurses there's a regulation in Louisiana also that authorizes school nurses to refer students to hospitals after medical screenings. So as you can see, there are, there's a lot of policies regarding the role of school nurses, but it cannot cover everything. And that's why I'm going to go to the next slide, pass it off to Janis to discuss some of the more practical implications of this.
Thank you, Heather and Devin. So we are now transitioning to the point of our moderated question and answer between Heather and Janis Hogan. Janis is a member of our LEAP advisory board. She is a nationally certified school nurse and has been a nurse for 45 years, with the past 22 of them being a school nurse. So we are very excited to have her speaking to kind of share a little bit more about how these policies kind of play out in practice and kind of where these efforts can be supported generally. I think maybe some of the big things that I'm taking away is just one, how much school nurses do. And I think thinking about the role that they played during the pandemic, kind of how they have become probably more visible to the school community and the broader community at large, and what that might mean for just general efforts around student health and how they can be advocates for what schools need and what students need regarding their health. So with that, I will pass it off to Heather and Janis.
Thanks, Kayla.
Thanks so much, Kayla. And Cassidy, I'll have you switch to the next slide. So Janis, when Devin and I were doing this policy scan, we had the joy of speaking with a school nurse who shared his perspective of working in schools and what his day-to-day looked like. We asked him, just because a state has policy doesn't mean that it's good or bad, and kind of wanted to hear his perspective on what policies would be helpful. And overwhelmingly, he said, we just need funding. We need more funding for school nurses so that we can have more school nurses. I'd love to hear what approaches states can take to secure more funding for school nurses and also for school nurse consultants. And if you could also kind of help us define school nurse consultants for those who might not be familiar.
Sure. So let me just start by saying that education dollars have traditionally been for funding for school nurses and school nurse consultants, just come from the public education fund, but other major funding sources include health departments, hospital systems, and grants. So funding for school nurses and school nurse consultants is really important because it is a barrier in providing health equity for students. School nurses do the day-to-day in schools, but school nurse consultants oversee programming within a state. So some states may have more than one school nurse consultant. Other states have no school nurse consultant. So like schools with no school nurse, they're at a disadvantage as well. So the National Association of School Nurses really does believe that school nursing services should be reimbursed, just as they are in other healthcare environments in the school setting. So because we are bridging that education and healthcare, doing services within the school is allowing students to be at school, because without the services that school nurses may provide, those students may not be able to attend. So think about a student with diabetes, or a student that has a tube feeding, or has asthma. These are services that nurses are doing every single day in their schools, and they're not being reimbursed. So there is decision makers, stakeholders from education, health, government sectors. They really need to collaborate to create and sustain adequate and equitable funding at both or federal, state, and local level. So when we had the pandemic, of course, we had funding that came from the federal government, and states could use those monies to increase their school nursing services. But that was really done on an individual basis, district by district. In my own particular school, I asked for more school nursing for my school, but because there was one nurse in the school, they thought that that was enough, even though I had over 700 students and 150 staff members. Because there was one nurse there, they felt it was adequate. It wasn't adequate, especially during COVID, when everything was increased for school nurses. There are some pilot programs going on. I read recently that Michigan received $1 million in federal funds through the community project funding in the federal government. And that is to increase their school nurses and address their school nursing shortage. And then in particular, in the state of Maine, we lost our school nurse consultant at one point, and then we had funding through the Healthy Maine Partnerships, which was through tobacco funding, and then that funding was lost, and we were going to be without a school nurse consultant again. And we banded together, we advocated with our legislators to make sure that we had a school nurse consultant. And she is now one of the only positions codified into law in the state of Maine. So we were very successful in that regard. And I guess the last thing I want to touch on is Medicaid. And in 2014, the Center for Medicare and Medicaid expanded use of Medicaid to pay for school-based health services for Medicaid enrolled students. Unfortunately, a lot of states have not or have been slow to get on board with this, because I really think that funding could help to support more school nurses.
I'm so glad you mentioned the Medicaid piece. And one of the resources that we've linked to at the end of this presentation is a piece my colleague did studying states' uptake of those Medicaid dollars and what some of the barriers are for those states who've been slower to pick that up. So hopefully folks will check that out and then see what their states are doing when it comes to those Medicaid reimbursements. I also just wanted to call out, there's folks in the chat sharing some of the advocacy that they've done in their state. Thank you to Lori for sharing a little bit about Michigan. Really, really fantastic to hear from folks kind of your own experiences with this challenge. One of the things that has really struck me in my work with school nurses and with healthcare practitioners outside of education is just how unique the role of a school nurse is. And Cassidy, I'll have you jump to the next slide. I'd love to hear Janis what are some of the actions that states can take to help build a school nurse pipeline, recognizing that it's rather unique even to other nursing responsibilities?
Well, I think one of the first things I'll address is pay equity related to the compensation for school nurses when compared to community nursing pay standards. We need to have pay equity to attract and retain school nurses. I still can't get over a school nurse colleague in one of the southern states as a full-time school nurse. This was just several years ago. She was making $14,000 a year. I mean, that's below the poverty level. So elevating pay is a big thing. I think school nurse orientation is another essential part of building the school nurse pipeline, because we work in isolation. When you walk into a school, if you don't have anybody else to ask, generally, what do I do? So having a state school nurse consultant develop in conjunctions perhaps with a state organization, as we did in Maine, we put together a new school nurse orientation, which the Maine Association of School Nurses partners with her in not only developing it, but also in delivering it to new school nurses. I think ongoing professional development and leadership opportunities is an important retention factor for school nurses, because if you're stagnant in a job, you're less likely to perhaps to stay. And leadership opportunities provide that staying power for school nurses. I think appropriate staffing is also necessary. You talked earlier about staffing levels and having a ratio of 1 to 500 or 1 to 750, which is what it says in the state of Maine. The National Association does not support ratios for student and staffing, students and school nurses, because my 750 students might have 20 diabetics. It could have kids with seizures. It has to be based on equity. It has to be based on acuity of the students. It has to be based on what are the social factors in that particular community. We know that poverty, homelessness, all of those issues contribute to a greater workload for school nurses. And when you think about a school, the only door that is open without an appointment is the school nurse's office. And so often those issues first come to the school nurse and they're never turned away. So we have to work on that. I guess two other things I would add is that promoting the specialized practice of school nursing in nursing education programs is really important, so that new school nurses know what's involved and have practicums in school nursing. Mentorship programs are important. And also, I guess finally would be, school nurses are typically in an educational program that where their oversight is by a non-medical or non-nursing person that doesn't know the job. So having professional and peer performance review rather than the oversight and review by academic leaders that may not understand, one, the job, and two, what the nursing board and licensing regulations are for nurses.
Gosh, you touched on so many fantastic things there. One of the things you talked about was that nurse to student ratio and just how much that depends on your student population and the need. Cassidy, I'll have you jump to the next slide. I'd love you to elaborate on that a little bit. We know there's a nationwide shortage of school nurses, and some schools are blessed to have a full-time school nurse. Some school nurses cover multiple schools in a district. And for many schools, just one full-time nurse is not enough for the needs of their students. Can you speak a little bit to some of the implications when there are not enough nurses available and an unqualified person takes on those responsibilities that should belong to a school nurse?
Yes. Well, first of all, I think the latest statistics are that only 40% of schools employ a full-time school nurse, and 25% of schools have no school nurse at all. So there's a huge equity issue right there. School nurses really play a vital role in advancing health equity in this country. We are the front line of healthcare for children. 56 million students attend school in the United States, and there's 3.3 million that don't have health insurance coverage. Those are the kids that you'll see on a Monday morning come to your office because they waited the weekend to come see you. And, what happened over that weekend that, could have been dealt with if they'd had insurance. So, school nurses are there. They're providing equitable access to healthcare because they are there to teach and assess, support the students. And without a school nurse there, those things aren't happening. Poverty, racism, homelessness, access to healthcare, food insecurity, all of the social determinants of health that we know about, those things are not addressed if a school nurse is not in the building. And if they are by perhaps another adult in that building, so for instance, let's say we have a student who has had a serious injury on the playground. You've got an unqualified person that may be addressing that need of that student. And yet, in addition, perhaps it's the school secretary. She may have basic first aid, but she doesn't have the same training as a registered nurse. And in addition to that, she's leaving her own job to take care of a student that should have had the access to a school nurse. So I could give you so many examples of what's missing when we don't have a school nurse. And I'll never forget when I first started and I went into a middle school and they had not had a full-time school nurse. And it was when I actually practiced in 5 schools at the same time. And the school secretary was handing out Tylenol from little baggies in her office, that had the kid's name on it, totally against regulations. And, to have to start over in that school and from scratch and be, okay, well, here are the regulations and yeah, we'll take those baggies away. And, having to train people who are unqualified or need training to adequately perform the job.
Yeah, and I love too that you touched on some of the contexts outside of school that can really impact students' health. The fact that their families may or may not have insurance, the health of family members that could impact the student's ability to perform in school. There's just so many interrelated things. So you really speak to the need of school nurses and how much that varies depending on the school environment. We have some more questions for Janis, but given that we have about 15 minutes left to the hour, I'm going to open us up to Q&A because I do see some Q&A coming through, pinging up for me. And then if we have more time, we'll loop back to Janis with any additional questions that we have.
Yeah, so I think maybe we'll start with Lynn's question here. I think this one, actually, I'm going to start with Donna's question about This is directed to Heather and Devin, asking whether the research addressed the role of school nurses in special education, developing IEPs and 504 planning. And I think Donna also mentioned in the chat a little bit about some of the context regarding how that might even relate to some of the Medicaid funding in Connecticut. But I think Heather and Devin, if you can weigh in with some of your policy research, and then Janis, if you want to add in to anything that they say.
Yeah, I don't believe that the policies specifically focused on the development of IEPs. They were very specifically focused on kind of physical health plans for youth that had chronic conditions, but not necessarily in need of IEPs. Yes, and I don't know if Janis has any additional context to add about the differences between putting those plans in place. I know that for IEPs, those are often put together with many folks involved, including the parents and family. And
So I could
whereas
say
I think
that,
the health plans might be much more focused on school nurse in particular with that expertise.
right, so IEPs are generally a team approach, and if a student has a medical issue that needs to be addressed in the IEP, then the school nurse would be involved in addressing that. In a 504 plan, those are mental and medical health issues that impact a student's education that do not have an individualized education plan. So they are very involved in developing those plans and implementing them.
Thank you. And I see here from Lynn a question about whether we need to be a school-based health clinic in order to provide STI and STD testing. I think you're asking, Lynn, whether or not it's like a policy that a school nurse has to belong to that setting. I will defer to Heather and Devin on that one. My guess is I think it might vary from state to state, but I also know I know some of our LEAP programs are thinking about how to increase access to STD testing. And I feel like even one of them might have talked about partnering with a university to provide like mail-in testing for students and kind of supporting it that way. I don't know the level to which a school nurse is involved with that. So if the TA provider who is connected with that wants to hop on and provide additional information, please feel free to do so. But Heather, Devin, and Janis, if you want to talk about that relationship with school-based health centers, that would be great.
Sure, I can take that one. Yes, exactly. It's not a good answer, but it varies for sure. that's what I was saying. Some state regs that I was looking at like specified school-based health clinics, but some were discussed STI and STD testing, but didn't specify how to get there. So I think at that point in those states it's open-ended, but I think, yeah, to see, I think looking through like from like a state by state basis is the best way to see like what the requirements are there.
Yeah, and I know that some states do have kind of community-based partnerships where they can refer those services out to a community organization or to a partner hospital. Again, kind of Devin touching on the school nurse hospital partnerships, that's one way that STD, STI training or screenings rather can be facilitated.
So in Maine, a school-based health center could certainly provide those services, but school nurses would not provide STI or STD testing at all. But the referrals to family planning would is certainly part of the role that they would play.
And I know this is one of the questions that we didn't get to in the moderated discussion, but maybe while I am seeing things in the chat about how people have teamed together. So I hope that, Lynn, you're seeing some of those answers as well. But I'm wondering, Janis, if the National Association of School Nurses has heard from school nurses on the ground, like hesitancies around supporting student sexual health given the political climate, and again, like maybe that more public view that they're getting after the pandemic. And I'm seeing some other questions in the Q&A, so please feel free to answer that and I'll keep looking through those.
Right. So yes, I think there has been a lot of chatter on the national school nurse listserv about what they can and can't talk about to students after Roe v. Wade, especially. It left nurses wondering what they can and can't say or do. We certainly support advocating for student sexual health. National Association is very clear on that. One thing that there are several barriers I think that happen. One is the fear factor of being reprimanded from administrators. Another is parents being adverse to students being given information. However, there are states like Vermont. In 2021, Vermont passed a state law that condoms must be made available to all secondary students. I mean, that's phenomenal. And yet in Texas, in a recent survey that I read, most school nurses reported that their schools limit their sexual and reproductive information that they can provide. So, it varies by state. And so when nurses are asking on the listserv about these issues, we refer them to their state law. And then again, it goes school by school, district by district.
Thanks, Janice. That's super helpful. I'm also seeing a question here from Ramona in Pennsylvania and wondering if there are any new policy changes for getting, I'm assuming the school nurse, like kind of separating out the school nurse contract from being under the teacher contracts. I don't know. I know that you all have like a limit in terms of time of when you were looking at the policies, but I'm wondering if you saw anything related to that.
Yeah, that's a really interesting question. And I feel like one thing we see in policy is that they can be sometimes either redundant or conflicting. So I know that, for example, when we say how many states required school nurses or addressed qualifications for school nurses, that is all, our search was specifically in education policy. So there's also health policy, and that can also be addressing school nurse qualifications, requirements, et cetera. So it could be present in health policy as well. And that is something that definitely varies state by state. Those requirements can be different depending on where you are.
Pat, that certainly would make our lives a lot easier, although I guess maybe it also provides, although maybe it also provides some flexibility if people, when it's needed. I'm trying to think. Heather, I feel like you might have kind of also addressed the anonymous attendee here about the 40%, the stat on 40% of schools specifying or that they have that they employ a full-time school nurse, and whether or not that encompasses a registered nurse or if that is like broadly covering a bunch of other things.
So let me, so again, the kind of qualifications and certifications that school nurses have, that also varies state by state. Some states require it to be a registered nurse, and some states allow for other certifications. And Janis might be a little more well-versed to speak to this. If I can find, let's see, some states permitted licenses and certifications that include licensed practical nurses, certified nursing assistants, certified nurse practitioners. So there's a wide range of licensing and certification that each mean different things, and states have different kind of doors open to different certifications. Janis, I'll pass off to you to see if you have anything else to add there.
Well, I can tell you that in Maine, you have to have a bachelor's degree to be a school nurse, right, and licensed as an RN. And it's, 3 years of experience before you can even apply to be a school nurse. School districts here do employ licensed practical nurses and nursing assistants, but they are under the direction of the registered nurse. So they cannot call themselves a school nurse in Maine if they are not a certified school nurse here.
Yeah, and then I would add some of our policies that we identified also addressed kind of the continuing education or kind of renewal of certifications. So for example, continuing to be certified in CPR, AED use, things like that are things that school nurses or those with other non-registered nurse certifications need to continue to keep up with in order to continue in that role.
Yeah, and in Maine, it's 90 CEUs are required every 5 years, or 3 college level classes applicable to our positions is required to remain certified.
That's some of the opportunity of state policy. When I was looking at some of the hospital collaboration ones, there's there's professional development opportunities with collaboration with hospitals. There's school boards building partnerships with community partners, hospitals, and other entities. So as we've kind of seen this state regulations, if there's a continuing if there's a path to continuing education, that could also be further fleshed out in state policy to kind of get the wheels moving.
Great. Thank you, everyone, so much for your active participation in this webinar, and also to our panelists and speakers for highlighting these. Cassidy, if you can please share the yes, thank you, the slide with the resources. Devin, if you want to run through these really quickly. I think these are just kind of some of our suggestions around what might be helpful, and also where you can go from here with the information that has been presented.
Yes, so I can move through this quickly because I'm seeing that we're close on time here. So if you want, we weren't able to get through all of the facets for a brief that we covered, but we have some fun maps and extra information on our on Heather and I's brief on the Child Trends website. And some of the other categories that are on there are just baseline requirements and whether districts must employ school nurses, regulations on school nursing qualifications, managing chronic diseases, infectious diseases, administering medication, managing student health plans, and much, much more. So if you have interest in any of these topics and state regulations relevant to your state or others, check that piece out. You can also, and Janis definitely will have more information than me on this, but on the NASN website, there's a directory on where to find school nurse consultants. You can find someone who's local to you there. On the updated LEAP profiles haven't been released yet, but they have some information on whether SEAs require school nurses. But that's forthcoming. And there's Heather shared with me an awesome Child Trends brief on Medicaid services. Kind of the main talking points of that are whether and a lot of these there's a lot of Medicaid policy issues that may intersect with the role of school nursing. This brief touches on which states have policies that allow or restrict Medicaid billing for school-based services, whether differences in state policy influence the availability of Medicaid dollars for school services, and state and local health officials' challenges and successes in implementing new Medicaid policies. Our friends on the next bullet, our friends at NASB have an amazing database, which I look at often, on codified and non-codified policies, state by state, on a variety of school nurse related policies, such as school nurse qualifications, school nurse professional development, and school nurse availability. And of course, my main takeaway, and the main takeaway from looking at all this stuff, is always, always, always integrate school nurses to your planning efforts. Their voices need to be centered at every step of the decision-making and policy-making process. So that's those are my next steps. Anyone have anything to add?
I think you summed it up well. Thank you so much, Devin. Thank you everyone for joining. We hope that you have found this useful. And if you have any questions, please feel free to, about the research in particular, please feel free to reach out to Heather and Devin. We will also, if Janis is okay with it, we will circulate Janis's email as well if people are interested, and we can also circulate the information about the LEAP inbox that you can ask further questions just generally about this topic area. Thanks everyone, and have a great rest of your day.